So my go-to medication for alcohol withdrawal, particularly in an outpatient setting, is gabapentin. Gabapentin was developed as an anticonvulsant, a seizure medicine about 25 years ago. And with a lot of seizure medicines, what we find is once they get to the market, we actually discover they're not really as good as some of the old standard seizure medicines. So what happens is physicians love to try new medications for different conditions. It's called off-label prescribing. So what we found over the years is gabapentin has a great deal of utility. And one of the things it does well is treating alcohol withdrawal. So the American Society for Addiction Medicine, ASAM, came out with guidelines when COVID hit of what would be an appropriate medication to prescribe in a home or ambulatory setting for alcohol withdrawal symptoms in COVID times. And the thought was it's going to be more difficult for people to get to a hospital or an emergency room for detox. So they've given guidelines as to dosing, utilizing gabapentin. The nice thing about gabapentin is that it's not habit forming. In comparison, the standard medications for alcohol withdrawal are the benzodiazepines. And so you've likely heard of these. They include Valium, which is diazepam. Librium is probably the most common benzodiazepine prescribed for alcohol withdrawal. Its chemical name is chlordiazepoxide. Ativan, which is lorazepam. Those are three medications that are often used, benzodiazepines. So those come with a set of side effects that can be more difficult to manage than gabapentin. The nice thing about any of these detox medications is that they work quickly. So gabapentin works quickly as well as the benzodiazepines. And so you really get relief of alcohol withdrawal symptoms quickly. Most common alcohol withdrawal symptoms would be sweating, shaking, nausea, vomiting, diarrhea, a sense of your heart racing, overwhelming anxiety, almost to the point of a panic attack. And these medications work within 15 to 30 minutes. So what they also do is they prevent you from progressing to a seizure. And one of the most dangerous things about alcohol withdrawal is that if it's left untreated, people are at risk of having an alcohol withdrawal seizure. And that usually occurs about 36 to 48 hours after your last drink. And the risk of withdrawal obviously is higher in people who drink large amounts of alcohol, who drink every day, who have a history of withdrawal. The other dangerous aspect of alcohol withdrawal, left untreated, is that kind of 72 hours out, you have a risk of delirium tremens. And so you'll hear a lot of people use the word DTs kind of loosely. And DTs actually are uncommon and severe and can be deadly. And people who have delirium tremens need to be admitted to an intensive care unit often. What takes you in that is that your blood pressure and heart rate becomes impossible to manage. It's either going too fast or going too low. So when people use the word DTs, what they're often referring to is what I call garden variety alcohol withdrawal. That's kind of 4 to 12 hours after your last drink. That's the shaking, sweating, nausea, vomiting that people have. So, but I would say in general, gabapentin is my preferred medication for alcohol withdrawal.
For expert support on medication-assisted treatment for alcohol use disorder, visit riahealth.com.